because we'll go through some stuff here that I think with some small changes in technique or very finite details about how we close laparotomies, we can really impact patient care. But he said one of the greatest opportunities we have to improve outcomes will probably not come from discovery of new treatments, but more effective delivery of these existing therapies. And so the wound length ratio of greater than 4:1, if you can achieve this when you close a laparotomy, it's a 3 times higher or lower risk of developing an incisional hernia. Out of the Washington State looked at this as well. He showed at 13 years, 23% of our patients are getting reoperated on for hernia disease. And so mesh does have an impact on hernia repair, but we're losing the fight to this hernia disease, and we need to find a different way to fight this. So, this was a quote by Royal College of Surgeons, Lord Moynihan: "Never judge a surgeon before you've seen him closing the wound." And I think this Israelson, who's sort of the godfather of this, did a randomized controlled trial. He looked at 737 patients, and what he found was that not only was the wound infection rate cut in half from 10 to 5%, but the incisional hernia rate was significantly different by changing the size of his bites. And so traditionally we're taught to do a 1 centimeter bite, 1 centimeter advance, slowly observing continuous suture. What he compared was a smaller bite, a 5 millimeter to 8 millimeter bite, 5 millimeter, 8 millimeter advance, and showed that by doing that we can significantly impact outcomes. Small needle, and the small needle helps us take small bites. He does the self-locking knots, uses a continuous suture, 1 layer of the aponeurosis, and then you place these small sutures. And he's this big stickler that you really should measure this and make sure that you're getting a suture to wound length ratio of 4:1. Going around, most people don't measure their suture to wound length ratio. Some people don't even know what that is. Railson kind of looking down at me sternly, and to quote him, "The only way to ascertain that our wound is closed with an adequate suture to wound length ratio is to measure it." And so I'll end with this video here, and this is kind of a boring way to end, but this is what we do at the end of our laparotomy incision. It takes about 5 minutes to do, probably less than that. We found in our first 100, when I audited this, only 76% of the time was I closing with a 4:1 ratio. And we need to start practicing the 4:1 and the small bite technique. There shouldn't be any more excuses, and I think we need to follow our outcomes and then